If you're starting Medicare and you want a Medicare supplement policy, are you aware that the first 6 months that you start Medicare Part B, you can get into a Medicare supplement policy without any health questions being asked? So in other words, if you have cancer or Parkinson's or some sort of chronic condition, the supplement company cannot turn you away. But what happens after you've been in that policy and maybe you want to make a switch, maybe you've gotten a premium increase, or maybe you want to switch plans? Can you get into that plan without any health questions being asked? The answer is going to be typically you have to answer health questions. You're going to be underwritten to change a plan. There are some states where underwriting is not required. It's just a handful. But for most of you, you want to make the switch, you are going to have to be able to answer the health questions. So what's an example of what I mean by this? So let's say we start working together and I put you in a particular plan and you've been in it a couple of years. You check in with me every year when you get the increase and I keep telling you, nope, you're good, your pricing is still competitive. Now we're at the third year and you call me up and I'm like, you're right, that pricing is too high. Let's see if there's other options out there in the marketplace. But the next question I'm going to ask you is, how is your health? Now, obviously what's behind me is too hard to read, but this is an example of what underwriting questions look like. They typically divide into sections: a list of chronic conditions that they're never going to underwrite, and then conditions where maybe you were sick, but you've gotten better and they'll take you. For example, a lot of the carriers, if you're 2 or 3 years cancer free, they're going to take you as a policyholder. So in listening to this video, what I want you to take from it is, first of all, once you choose a supplement, that doesn't mean that's where you're going to be for the rest of the time that you're on Medicare. There's a possibility you'll shop it. You may switch from G to N or N to G, or you may get these increases like I mentioned and try to find a carrier that's offering identical coverage with lower premium. Now, as I mentioned, handful of states where they don't ask the health questions, but typically those premiums are a lot higher. So just know there's options, and that's why it's also important. Find an agent that's going to stick with you and will help you shop this as you continue your coverage with Medicare.